Um, I was diagnosed with PAD in mid-February, and from mid-February until the end of June, I was improving my condition by walking a lot. At the end of June, I came down with anemia, and for the month of July, I couldn't walk at all. And now I'm at a point where I've overcome my anemia. Um, I'm getting blood work tomorrow that'll confirm that, but I know it's gone. Um, but my PAD condition seems to have deteriorated since the end of June. I can't walk as far as I used to. I'm experiencing more claudication than I used to. I used to be able to walk 6,000 steps, and in the last 3,000 steps, I would be able to walk quite further without experiencing claudication. Now I can only walk 4,000 steps, and I experience claudication all the way through it. So it feels like I've deteriorated. I've made the decision that I'm not going to talk to my vascular surgeon, because the last time I saw him, he told me that if I can't improve myself, the only alternative for me is surgery. So I don't want to go and see him, because that means we're going to be talking about surgery. I'd just like to know what you think of my decision. Do you think I've made a good decision just to keep trying to improve myself by walking, or do you think I should go and have a chat with him?
No, I mean, like, it's essentially, first of all, no one is doing something against your will. So even if you go there, you have a chat that says that he will never ever told you you need to have a bypass. Okay, so never, or any kind of endovascular, because it's not like life threatening. It's not, so it can offer you something, but you're absolutely free to say, no, doctor, I want to think about it more. Like, that's something very acceptable. No one gets pissed if you take more time to take your decision. Also, if this is like something that of course it's not really affecting you, as I said before, like the rest pain or ulcers and blah blah blah. I think that the best for you is still there are 4,000 steps, like still a good amount of walking. So like people who walk in my office and they say, doctor, I can only walk. Even when I came here, just from the lift to your room, I had to stop because of the pain. That's one sort of claudication which is really affecting them in everyday life. So
Yeah.
these people I try to convince in a way to have some treatment, because it's really could be really life changing. For you, I mean, of course, you need to balance risk and benefits, and I think that it's up to you. If you really feel that this is affecting your life in a way that has never done before, and then you are limited in what you can do or you cannot do because of this, then I suggest you have maybe some procedure done. What I suggest you at the moment is just to try to understand how bad the situation is from the number point of view. So get an AVI and try to get at least the duplex scan in order to understand how big the blockage is, because sometimes the blockage could be 4 centimeters, standard blockage could be 40 centimeters. And actually this puts also you in a different situation, because a blockage, which could be a stenosis, so a narrowing of the artery, which measures 4 centimeters, is a piece of cake to be treated. But if you have a blockage which goes, let's say, from the aorta down into the popliteal artery at the level of the knee joint, that's a completely different scenario. So try to understand better, try to talk to a surgeon or a vascular specialist you believe in, and try to consider all different options. Of course, balancing risk and benefits based on the amount of disease that you have. It doesn't matter if it's occluded or not occluded, but the length sometimes makes a difference, and the severity of your symptoms. Yeah. Don't smoke, get your diet balanced, and physical activity is already a treatment. So, try to go with it, and then you can go for surgery if you need, or if you think that this is really affecting your life and quality of life.
Yeah, and Alan, we always suggest, no matter what, even if the doctor does talk surgery, and we use it sometimes, as a general term, he might be, talking about doing bypasses or endarterectomies, or they might be talking about doing something minimally invasive. And so it's good to clarify. But in either case, we always say conservative therapy, number one, is best, and number two, to always get a second opinion before having any procedure, no matter what procedure it is. Always get a second opinion if you can.
Yeah, get a scan. The scan can be watched by different people. You can even send a scan to 10 different people. 10 different people can tell you 10 different answers. And actually, you try to pick what the one that you think it's more reasonable, you know. But I think, like, try to get a diagnosis made by numbers in order to, let's say, put a number to the severity of your disease, and also get a scan in order to understand how big the blockage or the narrowing or the disease is, because that makes a difference in decision making and treatment options.